Hello everyone, today we will talk with you about meniscus injuries, about where it comes from, what to do, cut or treat, and what loads are possible, and which ones are not under any circumstances. Let's go. The menisci are two semicircular cartilage plates located between the femur and the tibia. They improve congruency, that is, the alignment of the joints, improve shock absorption, and protect the knee from premature wear and tear. A very common situation is a meniscus injury. They can be divided into two categories. Degenerative, that is, those that arise due to improper prolonged stress on the meniscus as a result of the overall aging of the organism and the joint as a whole. And acute, that is, those obtained during trauma, for example, in football or skiing. What types of meniscus injuries are there? In our country, it is customary to classify injuries. This is a classification based on magnetic resonance imaging examination. Probably, after reading your magnetic resonance imaging, you might see injuries classified as STOLER2, STOLER1, or STOLER3. What is this? It's a classification system that indicates the degree of meniscus injury. The first and second degree of meniscus injury are always degenerative. That is, for the most part, it's not a meniscus tear, but internal changes within the body of the cartilage. Most often, these are either point inclusions on one or small linear cracks at two. The real meniscus injury, when there is a tear at the edge, begins at the third degree. Here they highlight Stoller 3A. This is the stage when only one part of the meniscus is torn and the second edge is holding. And Stoller 3B when the tear is complete. And in fact, we have a free segment of the meniscus in the knee joint. People often come to me with pain in the knee joint who have already had a magnetic resonance imaging and found some degree of meniscus damage according to Stoller. And they face such a problem that they come to surgeons who recommend them to have surgery. What are the criteria when you need to go to a surgeon and cut, or when such tears can be treated conservatively? The thing is that a lot of different things can hurt in the knee, and ligaments and muscle attachment, and there can be displacements of the bones themselves. That is, a huge number of structures can cause pain. Therefore, first of all, it is necessary to diagnose well whether the pain really comes from the meniscus or the meniscus injury is just a random finding. With magnetic resonance imaging, you can determine if the pain is from the meniscus in two ways. First, by conducting special tests for meniscal pain. The simplest test that you can conduct yourself is to stand on one leg, slightly bend it, and rotate along the axis. This is also very good at identifying specifically meniscal pain. There will be a movement like a lotus squat when we pull the leg towards ourselves. This will be very characteristic to give pain at the end of the movement amplitude for the posterior medial meniscus, also for the meniscus characteristic pain at the end of the knee joint flexion under load. That is, when we sit on our haunches. Pain from the meniscus is almost always located in the projection of the joint cavity. That is, if you have pain above, below, or along the vertical line, it is most likely not the meniscus. Also, if you can palpate your pain, that is, roughly speaking, change its characteristics by pressing or rubbing, then this is also most likely not a meniscus. That is, the meniscus most often hurts directly along the joint line quite sharply and quite deeply. Usually it's not a lingering pain, but a sharp pain with a slight pinch of the meniscus. Another important symptom is a knee joint block, when during movement the joint locks up and cannot continue to move for bending or unbending. Usually, to get out of the block, a person needs to cleverly twist their leg or jerk it a few times to unlock the block. Sometimes the blocks are strong enough that it's impossible to deal with them on your own. Either an orthopedic manipulation is required or manual therapy work to unlock the knee. But if the pain is of some other character, then it most likely does not come from the meniscus. After we have ruled out or confirmed meniscal pain, we need to decide how to treat it. The first and second stage practically never cause any pain. Therefore, if you have been diagnosed with the first or second stage of degeneration postular, you can rule out the meniscus from the list of suspects. However, if you have a third A or third B stage, then the pain may be associated with the meniscus. And here you need to understand whether it needs to be cut or not. In my experience, if there is a locking of the knee joint, this is a direct indication for surgical intervention. That is, it is necessary to perform a so-called sectoral resection. This is when they enter the knee joint through a small tube and suck out this torn piece of meniscus that locks the joint, going into the wrong position. It is very important to remove this segment between the femur and the tibia, because if we have continued locking, it can damage the tibia or femur. If you have a type 3A tear and the segment is not completely separated, there is no locking of the knee joint, and you do not experience sharp meniscus-like pains. In all positions, in principle, you can work conservatively. The exception are people who really want to play football or actively engage in downhill skiing or other sports games. Most often, it will still be safer to perform surgery on such patients, because most often the problem arises when the foot and knee turn relative to each other without control. This is a super common situation in downhill skiing when a fall occurs and the foot turns separately from the knee and the ski does not come off in this case. Or when in football we turn on one foot during a strike. If the patient is involved in such sports, then most likely he will tear it and it will be a very unpleasant situation. Therefore, it is desirable for athletes to still have surgery. If you are involved, for example, in long distance running or swimming or cycling, or do not play sports at all, then a type 3 meniscus tear can be treated conservatively. So, if we decided to treat the meniscus, then the therapy of the degenerative process will differ greatly from the acute one. If you had an injury, then you definitely need to wait 3 to 6 months. Why? Because first, we need to remove the swelling from the meniscus, and second, we have to wait for the red zone to heal. The meniscus has two zones, the red zone with blood vessels and the white zone without vessels. The red zone of the meniscus is closer to the edge of the knee joint, and because it has vessels, it can heal. And within 3 to 6 months, the red zone heals and there is a sharp decrease in pain. Also, the swelling decreases and the knee joint adapts to the new conditions. That's why often after 6 months, the situation becomes quite manageable. There was such an interesting American study when a group of people with a meniscus injury, but without knee joint locking, underwent surgery to resect the damaged meniscus. And to the second group, they made a cut on the skin and said that they did work on the meniscus, but in reality it was such a sham operation. And they looked at what would happen in 6 months. And after 6 months, in both groups, the knee joint pain and functional level of people were approximately the same. This often speaks to the fact that surgeons are rushing to perform meniscus surgery. In modern society, the number of knee surgeries is much higher. Regarding the meniscus, because this system has worked out very well and has been put on mass production lines. If you look at the situation 25 to 30 years ago, when it was not possible to carry out a large number of operations so quickly, these same meniscus injuries were treated conservatively and had very good therapy results. The only thing is that it takes a little longer and causes certain negative feelings in the patient because the pain remains quite intense. Over the course of 2 to 3 months, surgery quickly relieves a person of pain, but after 6 months, the quality of life and pain results are the same. So, what can and can't be done when the meniscus is injured? First, you need to play sports games with great caution, especially football. Also, it is desirable to limit or be very careful with skiing. During skiing, it is desirable to use a hard knee brace to prevent any unexpected twisting in the knee. From physical exercises, it is not worth doing squats sharply and deeply, especially with weight and sitting in a Turkish style or in a lotus position. What can you do? Cycling, long distance running, swimming, rowing, and also workouts in the gym, functional and strength. In fact, only game types of sports and mountain skiing fall into the restrictions. So, if you have knee pain and suspect a meniscus injury, the first thing you need to understand is whether this pain is from the meniscus. The second is to understand the degree of meniscus damage. And if it's the first or second degree, then don't worry and deal with other problems. Third, if it's a grade 3A or 3B, decide whether to treat conservatively or to cut. And fifth, limit football and downhill skiing and engage in other types of sports practically without restrictions. If you have any questions, write them in the comments, I will definitely answer them. Come to our broadcasts, watch the videos. You were with Doc Demchenko. Everyone stay healthy.